Hello? Is anybody there? Okay. We're not actually looking to see if anybody's there, like down the hall or in a room hiding. We're today talking about pupil assessment, known as PERRLA. And the reason I want to talk about that today is because as an educator, I am finding that I have to reteach this one a lot. Like probably 9 times out of 10, I am revisiting this particular topic, and it's one of our basic assessments that for me, I think you should be doing on every patient if you work in acute care. Why? Because it gives us information, vital information. So we're going to talk about what PERRLA is, how to do it, and why you want to know how to do it right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. So a quick non-invasive checkup of your eye's health, function, and appearance is known as PERRLA. This stands for pupils are equal, round, and reactive to light and accommodation. So let's go first of all through the pieces. P stands for pupils. Pupils are the dark color part of your eye, the iris, the colored part in your eye. I don't know if you can see it here, but oh yeah, there it is. Look right there. The middle part. You knew that though, right? I'm just playing with you. So pupils is the dark colored spot in the middle of your iris. We want to make sure that they're equal in size and in shape. Now, most people have equal pupils. When we see different size pupils, we have a term for that called anisocoria. Anisocoria means greater than 1 millimeter difference between pupils. So our pupils control the light that enters into our eye. We want to be looking to see that they are equal in size. So both eyes we're looking at to make sure that the pupils are of the same size in each side, both with a light shining and when there isn't a light shining. So we're going to get into that in a minute. Now, aside from being equal, they should also be round. Our pupils should be perfect round little circles inside of our eyes. When they are not, then we want to begin investigating to make sure there isn't any pathology that's causing that difference. Round and reactive. So reactive is really just a keyword to remember that we need to test it to light and accommodation. So our pupils do respond to the amount of light in our environment and whether we're looking near or far at objects. Now the equipment you're going to need for this is a pen light. A pen light is the only tool you're going to need because we can use this both to check for our reaction to light and accommodation. So first, reaction to light. Now in your textbooks it will say to dim the lights and make a lower lit room. You can also do that just by putting a piece of paper, because in a healthcare facility you don't always have the option to turn off the lights, but sometimes just getting rid of the reflection from the ceiling with a piece of paper, your nursing notes, will help to see those eyes better. Before you shine a light in your patient's eyes, you want to just be looking at both of those pupils and looking to see what size they are and kind of getting a measurement pre-test. The first thing we're going to do is take our pen light and we're going to shine it in one eye, and we're going to look at this eye's response, and then we'll move the pen light away. And then we're going to shine that light in the same eye, but we're going to look at the pupil reaction in the other opposite eye to make sure it is also reacting to the same degree. So let's start that. So in assessing the pupils of your patient, take your pen light, and when you turn it on, you want to come from the side of the eye, not directly in front, because that's a bright light we're shining in there, and the pupil will constrict either way, but it's a little kinder and gentler to come from the side. So you'd want to come this way or angle it a little bit forward so it's not a direct on light in the eye. Okay, so we're going to start looking in this eye first. Letting that eye reset, and now we're going to focus on this pupil. And we're going to switch eyes again, so we'll let that kind of reset for a second. We're going to be looking in the eye which I shine first. And then take a look at this eye. And this is known as a consensual reflex. So when it comes to accommodation, I'm going to be looking at the objects beyond this camera, and then I'm going to be focusing my attention back on my finger right in front of my nose. So what you should see are two things. There should be a change in pupil size, which may be quite subtle considering my room here is not that big. But the second thing you should see is that when I come into focus on the object right in front of me is that my eyes should come in. That's called convergence. So we're going to start with looking far away and note the pupil size, and we'll be looking for a subtle change as I focus on my finger in front of my nose. You will have noticed that my eyes have come together as I focus on the nose, and the pupils should have gotten smaller. And far away. Close up. And that would be accommodation. Okay, so looking back at the accommodation bit, it really was a challenge to demonstrate that subtle change with the pupil size and the convergence. So practice it on your own for sure. Have somebody else you can look at. That will make it so much easier. Some of the limitations of doing home videos solo. So that is PERRLA. Now when you go to document it, how you want to document your pupil size is the initial size. So for example, mine were 3 millimeters going down to 2 millimeters. So you go 3/2 both eyes if that was the case. Have fun practicing your assessment of the pupils, and don't forget to do it. It's such an important assessment. Remember, it tells you information about the nerve system, the blood supply, and the brain. All good things to know about, especially when you're taking care of patients. Until next time, make it a great day. Hey, I know you're probably not ready to get off your phone or go back to work just yet, or maybe even turn the lights off to go to sleep. So why don't you spend a little bit more time here watching another video.